At this point, I'm going to introduce Shannon Ross, and she's going to be monitoring your questions. And then at the end, we're going to go through the questions that Shannon's going to be collecting. And Shannon, I work with. She's her and I have been kind of the backbone of DDME for about 10 years now, and really glad that she's on with us. I also wanted to thank our sponsors. We have, DDME is putting this event on, but it would not have happened without Kettenbach USA, and Tia is on from Kettenbach. And also I wanted to give a special thank you to Burbank Dental Labs. And Burbank Dental Labs really stepped up, and they're actually going to be issuing you your CE credits for today's session. So be sure to know that without Kettenbach and Burbank Dental, this would not have happened. And one of the features of the webinar is that we have some downloads available to you. So on your little control panel, there's 3 downloads, one from DDME, one from Burbank Dental Lab. It'll say BDL, Burbank Dental Lab. And then the third one's from Kettenbach, and I invite you at any point in time during this presentation to download those. Finally, I think I'm going to just take a moment and talk about Dr. Mericle for just a moment or two. I met Dr. Mericle about 7, 8 years ago, maybe more.
Yeah.
We were just at a dental sleep medicine event, and we just kind of had a camaraderie instantly, and we have been working closely together ever since. So I know her very well. She's a great friend. She's been a good friend of me personally and of the company, and she's an expert in dental sleep medicine in her knowledge and in what she does. She has a dental sleep medicine practice that's thriving and doing well. So she has academic knowledge, and she knows where the rubber meets the road. And that's one of the reasons I appreciate her style of teaching. So with that being said, I'm going to go ahead and turn it over to Dr. Mericle.
Okay, well, thank you, Jeff. And it's good to see you too, Shannon. And I'm glad everyone's on here tonight. I'm in Georgia, and you can probably tell from my accent. So it's 5 o'clock here, and I'm ready to go. I'm sorry my camera's not working, but I did brush my hair and everything for you. But anyway, this is going to be a great course, and I know you've been on a ton of webinars, and I'm glad you have, because this is the best time to learn, new, options, new services, to add to your menu, or to kind of go back and look over maybe what you maybe missed in another course. And this is going to help you improve your outcomes. This is going to show you, once you've screened, what you do from the beginning and how you make a great outcome, outcome out of this. And your dental sleep practice can just, soar. And we'd like to help you on your journey. I mean, it's great. I do it in my practice, and I'm a general dentist. So dental sleep is probably 40% of my dental practice now. But I place implants, I do Botox, I do filler, I do threads, I do sedation in my practice, root canals, I do third molar extractions. I did some today. I am just outside of the box in my practice. And, I do, I treat children, I treat adults for sleep. So my practice has just grown. And the more, from the beginning, when I've been in practice almost 29 years. And so my practice is just changing, with my age, I guess, or with the outcome of what's going on. And this, downtime that we've had, you really need to think of it, everything happens for a reason, and all good things come out of, things that you make good. And so this is a great time, if any of you have not started back in your practice, to start looking at this and see ways that you can improve it, and maybe write down some notes so that you can get your team on board a little bit more as well. And I might throw in some practice tips, and you're welcome to contact me anytime. I'm open, I'm ready to help you. I'm very passionate about sleep. It's something that you can change a patient's life with. So I'm gonna get started on this, and let's see, here we go. Okay, so what you will learn in this session. Today we're going to talk about screening techniques using the Gym Pro. We are going to discuss bite registration methods. And these are, and the thing like Jeff said, where I know where rubber hits the road, and I do, because I do this every day in my practice. I think I own 7 or 8 Gym Pros. They go out every day. They go out every afternoon, and they come back every morning. And we go over it. And, the bite registration methods, this is a method that I use in my dental practice. And we're going to show you how to determine optimal anterior, posterior position and vertical dimension. We're going to discuss the importance of the vertical dimension, and it's going to make it easier to select an appliance for your patients. Because I know a few of these are obstacles that seem to get in dentists in our way to make us maybe not move forward with the sleep or be as successful with dental sleep in our practice. So we're trying to help you, further your journey and just be a little bit more successful and make it easier on you so you don't get frustrated and the patient has a smooth outcome. Okay, this is the Gym Pro. I don't know how many of you are familiar with this. However, this is one of the best tools that as dentists we need to have in our toolbox. Like I told you, I think I have, 7 or 8 of these Gym Pros, and they're easy to use. And if you look at the diagram, this is what goes with the Gym Pro. It's really easy, to set up. And if you look, what the Gym Pro will give you is it will give you the patient's, desaturation, the oxygen level. And what you do is you look at the oxygen level, and I'll go through some reports with you in a moment, and I'm going to explain to you so that you can read it. And also your team, a lot of my team members, I challenge them and they'll go ahead and put what they think, and then we'll go over it so that we can all talk about it and understand it. And then we can explain to the patient why we feel they may need to seek medical help, or, what's going on with them. And patients love to wear this. And I offer the Gym Pro. I offer it free in my practice. And what it does is the patient takes it home overnight, and we'll show the patient how to set it up in our practice. And so all of my team members know how to set it up. All of us have worn this overnight so that everybody's familiar with it. So it's going to tell you the oxygen level, if the patient has any desats while they're wearing it. It's going to tell you the patient's heart rate. And those two are issues that you're going to look at to see if there may be, a medical condition present. It's going to tell you the patient's parafunction, their bruxism, if they're bruxing or if they're clenching. Many of us, I have a lot of patients. I had one today, as a matter of fact, this woman that told me that she used to, grind and clench, but she trained herself not to do it anymore. And thank goodness I had because I'm back in practice. Georgia started last Monday. So I'm back in practice, and I have this huge N95 mask on, and I have 2 other masks on top of it. I have my loops on. So she didn't see me cracking a smile behind all this masks. Also, it talks to you, it tells you about snoring, and it shows you the audio, the volume of your snoring and the grinding and bruxism noise from your teeth, when you clench or when you grind. So it also, shows that on the Gym Pro. And it also discusses and shows you the body position of the patient, which is really important when you're going through this report, because you can help the patient with positional therapy if you follow the body position in all the settings. Okay, why the Gym Pro? Why not just use a home sleep test? Because some patients don't want a home sleep test. They don't want to know if something's wrong with them. They don't understand really what a home sleep test does, or even an overnight test. So this, we call it, it's a screening test. And that's what I explain to patients. This is to screen you because I see that maybe you have some, abstractions present, or attrition, a lot of wear, in the patient's mouth, a lot of crown and bridge in the mouth, maybe some implants that have become loose. So, we're looking at this where they have damaged their teeth. So, you're talking to the patient, and why I'm doing an exam on the patient, an oral cancer exam, I go down a little bit further and I explain to the patient that I'm also going to include an airway exam, and I'm doing all this free for the patient. And I explain to them, I said, I tell them when they stick their tongue out for me, I'm doing an oral cancer screening for you, and they thank you. And then I also tell them that I'm doing an airway screening. And then when I look at their tongue, when I look at their airway, I can tell that they're probably snorers, that they're snoring. I can tell they're having problems. Their tongue scalloped, their uvula swollen, it's red, their neck size. I'm just looking at things, the bruxism and grinding, because all that kind of works together when a patient, has apnea event. Afterwards, it's a reflex to have a response to probably grind or clench your teeth afterwards, trying to gain control of your jaw. So your eyes will focus this, and you'll see red flags as you screen your patients. So I'll say to my patient, and if it's a female, I will ask the patient if she purrs. Yeah. And they look at me, and I say, well, but sometimes I'll roar like a lion, sometimes when I'm sleepy. And the older I get, the more I'm snoring and not purring. But purring sounds a little bit sexier than snoring, okay? So I'll tell the patient, if it's a man, I'll just say, do you snore? Or has anyone ever told you that you snore? So that's, that's a start to engage a conversation. That's to start the conversation with the patient. And then I'm looking at the patient, like I said, do they have any nocturnal parafunction? You ask the patient, do you grind or clench at night? I don't know. But you can look at their mouth, and you can look at their dentition. You can look at the, occlusal surfaces and see whether the patient is doing something. And, they're not, the likelihood that they're doing that during the day, they can have some during the day, some grinding and clenching as well. But usually the damage is done in the, in the evening, because the bite force, and I'll talk about that in a moment, is going to be greater. So you look at your patient and you go, what is the likelihood that your patient has sleep apnea? And just a note, don't tell the patient that you're looking for sleep apnea. You may mention some kind of breathing disorder issue, because when you say the word apnea, it's just like when you say root canal, the patient wants to run. So you just may want to say, the snoring sometimes it can be nothing but snoring, or it can be a medical condition, because you have to remember snoring is a partial obstruction. Apnea is a complete obstruction, but snoring is a partial, but it can become, apnea, especially if you give the patient, or not give the patient, but the patient entertains with alcohol or some kind of, medication, sleeping pill or something that's going to relax them, any kind of benzodiazepine. Those, can turn a patient into an apnea patient. A night guard can turn a patient into an apnea patient. And that's, the beauty of this Gym Pro. It can help you with all of these, questions or thoughts that I just said. And all three of these issues can cause excessive warranty and to redo your work, to your crowns, to your bridges, and your implants. So what I do is, because I do all this in my practice, what I do when I do a treatment plan is I put in the treatment plan, if they're going to get, at least 2 to 3 single crowns, they have to wear the Gym Pro. And we're going to put a night guard in if they have to, or we're going to put a sleep appliance if they need that. It's just whatever the Gym Pro, what comes out of the screening is going to lead me in the direction. So every time this Gym Pro goes home with someone, and I told you I don't charge anything, because when it comes back, I am going to either get a night guard for the patient, a snore guard, or a sleep oral appliance. So my return on investment is going to come back after 1 or 2 patients. And so that's what, the beauty of this, Gym Pro is, because it has so many attributes to offer to you. And also for implants, you know how many implants that I didn't do, thank goodness, I'm sure I'll have my time with it, but are loose. And you've got to go in there and you've got to, make access through it and find the screw and screw it in and put a composite over it, because the patient is flexing and clenching and they don't have anything to protect their work. So when you look at this with the Gym Pro, look at the 3 questions. Does your patient snore? Do you see, any kind of parafunction going on, any grinding, any clenching going on? What is the likelihood that your patient may have obstructive sleep apnea? So you need to look at these 3 and, ask yourself, does this patient have an undiagnosed medical condition? And you will be shocked. And I'm shocked, but I'm happy at the number of people that I have screened and they have treatment now, whether they decided to get an oral sleep appliance or whether they're severe and they have a CPAP. But it feels good to have them diagnosed. And this helps you build, and I'll go on to this helps you build referrals. And so the Gym Pro is a great screening tool to have in your dental practice. In the Gym Pro, and you need to explain, it's not a sleep test, it is a dental screener. And that's what we need, and that's what patients need. They just need to kind of be, set up with it and just kind of ease themselves into what's going to happen or what's going on. It's an easy setup. We have one of our team members show them how to set it up before they go home. We send it home with them. And a lot of dentists have this question. do you have them sign a form? Do you have them pay for it beforehand? Have you ever had, someone not return it? I never have. And I met Jeff like in 2000, I think at 11. And so I've either had the Gym Pro, a DDME, I've had something, to send home with my patients. So what I do and what you can do, and I don't really do it, most of my patients I know, or you kind of get a vibe from people if they're going to put it in. I've never had anybody sell it on eBay, or I've never seen it on Facebook for sale. They know I will hunt them down if they take my Gym Pro. But you can have a form they fill out and they sign it, or you can have hold a credit card. You might want to tell them, not to leave it in the car with the son. You may not let children play with it, or leave it where your dog can get it. But patients are very trustful, and they take care of it. So you send it home, and the reports come straight to your email. So the next morning, you are going to have a report, and we go ahead and schedule the patient for maybe, between 9:30 and 10:30 to come in, and we go ahead and have a time set. They can have a cup of coffee while I'm looking at the report. Then we bring them in, and I discuss what I found with them.
Dr. Mericle, this is Jeff. I just wanted to kind of interject here on an important part, and the reason I'm talking now is because I have years and years of experience in sleep labs and diagnosing patients with sleep disorders long before I came and started working and partnering with dentists. And in those years of working in sleep labs and developing sleep diagnostic equipment, we all who deal with sleep disorders have a common problem, and that is sleep disorders occur during sleep. And I know it sounds ridiculous to make that statement, but the reason it's important is the ADA and other dental organizations have all recommended dentists screen for sleep disorders, specifically sleep disordered breathing. And the issue with any sleep disorder is because it occurs during sleep, patients don't know they're doing it. So here's the quagmire that we're in. If you ask a patient, are you tired during the day? They'll say, absolutely not. I function perfectly during the day. Well, they fell asleep in your chair and they're snoring in your chair. You wake them up and then you start asking them questions, and they will deny that they have any type of sleep disorder. So when the ADA and other organizations recommend that you screen for patients, some dentists take that to mean that I will just ask the patient if they snore, if they're tired during the day, and if they say no, then I've done my screening. The challenge there is those of us who've been working in sleep know that the vast majority of people don't know that they have a sleep disorder. And where this comes into dentistry and where you as dentists see this is tooth wear. And you'll ask a patient, listen, I can see dentition on your anterior 8 teeth. And you guys know the answers you get to that. I don't have to tell you. I know everyone on this call, when they bring up wear, the crazy answers that you get. I don't know how that got here. The other dentists I used to have grind my teeth down, or whatever they might say. It's crazy, and it's not unique in bruxism. It's just a function of sleep. So I just wanted to bring that up, Dr. Mericle, is something that sleep is very difficult to get a beat on unless you collect objective data. If you rely on asking the patient, it's very difficult to get a good answer, not because your patient wants to lie to you, but they just don't know. So anyway, just wanted to share that.
Yes, and that's exactly the truth. And that's one thing about me lecturing, because I do this every day. And every day, and you have to be careful, like the verbiage that you use, because if you just say, do you snore? And they'll go, no, I don't snore. And I'll say, does anybody ever tell you you snore? Well, my husband says I make noises, and I said, well, are you sleeping during the day? No, I'm great. And I said, well, I just woke you up, or when I did sedation on you 2 weeks ago. And that's where I get a lot of my patients is when, I have them, under, and then they start snoring. And, I don't want to record them because that's probably will get you in trouble. However, I make a note of that, and my assistant's there, and we discuss it with the patients. And that's another thing about oral photos. You need to take oral photos on every single one of your patients. It only takes a few minutes, and we do it on every single patient. We treat every single patient the same because, number one, you can see the wear. You can show them the wear, and that's where, it comes into play. You could, a photo, says 1,000 words. So you can do that. Also, we as dentists are in the most unique position that we can be in. No other healthcare giver has the patient back, look in their airway like we do. We can look, in their nasal airway as well, deviated septum or swollen turbinate. But if you look at that uvula, and that's what I usually do, I wait until I, tell them I'm looking at their airway, and I call out, they have a Mali-Patti class 3, they have an elongated uvula, they have a high, elongated palate, they'll say they have a maxillary torus, they have mandibular tori, they have a scalloped tongue. And when I say scalloped tongue, that's a red flag, because what they're doing is the tongue is being pushed forward in their mouth because it's obstructing their airway. So the tongue is, the muscles are active, and the hyoid bone and the genoglossal muscle and all that is working to get it out of the way. Your brain's working to tell you that. And so those are things you look at, and a patient will say to you, they do that. They don't mean to lie, like Jeff said, but they do. They think it's bad. But so when I say I purr, or snore, then they kind of, go, okay, well, so do I. They don't want to, be bad. Or when you give them an Epworth sleepiness scale, those are things you need to look for, and you've got to be able to engage the conversation. And when I hand out the Gym Pro, I don't always say it's for sleep or for the oxygen. I always tell them, as a dentist, I diagnose bruxism and clenching, and I can tell that you are doing this, and it's free. Take it home so that when I make you an appliance, I'm going to make the very best one for you. And they like that, and patients want to know about what they're doing. It's all about, this society today, it's all about me, and it is. You want to celebrate yourself, and you should. So, they want to know, they think it really is cool the way, when you interpret the reports. They're simple to look at. I mean, I've taught my team how to do it. Jeff and Shannon are always available. That's why I love those guys so much, because they have both taught me so much and spent so much time with me. Because like I said, California and Georgia, and I'd have extra time when my children, when they were smaller and they were doing things. So they want to learn. They're excited about it. They have a passion for it. And I have, got that same passion. So, you want to learn about it, but you don't have to know everything. But these reports are so easy to interpret. So you can explain it to the patients, and then you're looking at desaturations. So when you see a desaturation on a patient, that should be a red flag. And if you see snoring, especially loud snoring that the Gym Pro shows you, that's a red flag. And it also calculates the force of the bruxism, nocturnal parafunction, and the frequency. So that means, how powerful is it? What's the magnitude of the force, and how often it happens. So the patients need to know that, because really and truly, when you start talking to people, they may not get it that first appointment or the second, but don't give up, but don't be too forceful like me sometimes. Just don't give up, but just keep kind of building it, and just don't let it go away. And they will finally come to you when, some of them just come easy and they just fall right into your arms. However, some of them kind of, push back. But it gives you a chance with this Gym Pro, though, to develop a protective strategy for each of your patients. And that's what you tell them. I want to do what's best for you. And then you guarantee their, their work too, if they do have something to protect their teeth, some type of appliance. And then if you see an issue, a medical issue, and you have to work with a physician when you do sleep, and physicians want to have a mutual partnership. So remember that, and you'll go out and meet these the doctors and specialists. But if you don't treat sleep, then you got to know who to refer it to as well, dentist-wise or whoever makes the appliances. Okay, this is what the Gym Pro looks like. And to the left of your screen, you can see what the report looks like. There's numbers, they're color-coded, and the colors, they correlate with the body position of the patient. And so each, the saturation, the heart rate, the bruxism analysis, the snoring, the position, all of this relates to each other, the body position. So it's all, together. So you look at it, and if you look at the photo to your right, that's what the Gym Pro looks like. That's all it is. It's very simple. The patient can put it on. You can put it on children, as long as they're monitored by an adult, but And an older adult can do it. And you got to remember that the colors on the graph, and I'll show you this next one here. This one you can see a little bit better. If you look at the top, and this is, the pulse oximeter right here, and this tells you, how much, this is going to tell you here, about if they have desats, if the patient's desatting, if the patient's losing it, because it's going to show you how much oxygen is in the blood on that patient. And that bottom number, where if you look at it, it says the max is 97 and the bottom is 85. Well, we want that number, some say 90, some say 92, but we want it to be above 90. And it should be. The patient should be above 90, during the day and when they're sleeping. All the time it should be. And if it's not, if you see some desats, then that's kind of telling you that there's a likelihood that the patient has a medical condition. Do not try to diagnose anything. Just make note of that. Okay, and if you also look at the color coding. Do you see the color coding? If you see the red, do you see how the red is and how it kind of goes down below that dotted line? If you can see that on your screen, if you can zoom in on it or whatever you need to do, but that right there is telling you that that patient is on their back. Okay, that's red. If you look at the guide on the very bottom, the position analysis, red is for the back, it's on your back. So what you'd want to tell that patient, just by looking at this first one, we haven't even gone through the report, that first area, you want to tell that patient they need to get off their back. Okay, and if you look at the green, that's left, that's their left side, and see it's above the dotted area, and then the right is the blue, and that's above. But if you look at the red, that's when it starts to hit the dotted line. So this patient could benefit from positional therapy. That may not be all they need. They may need a little bit more, but they need to stay off of their back. And this shows you why they need to. And this is, what this is telling you. And, the colors of the graph indicate the body position. And it works on all the graphs because all of these graphs are all on the same time axis, if you look at it. So you can generally get a sense of body position, how the body position plays a role in the quality of sleep that your patients get. So, because if you look down a little bit, and we're going to come back through, look at their heart rate. The next one, look at the red, okay? If you look at it, where it's going down right there, and then if you go to the audio signal, the snoring, look where they're snoring the most. And also the blue on the right side, you see that? So this is a good guide to show you, and this kind of tells you, and the patient will probably come clean with you, be honest with you, when they tell you, the only time, yeah, I do snore when I'm on my back. So I try to roll over, and you can tell them, they say get a tennis ball and sew it in your, t-shirt. Well, you're gonna have to have, 5 t-shirts with tennis balls because you can't wear the same one over. There's sleeper bumpers, there's all kinds of things out there that have Velcro that wrap around that you can use to help the patient stay on the side. There's, different types of, products that help the patient. But what you need to say, though, to this patient, if you're looking at this patient right here, this report, the red is on the back, and you can see where they're going down, the oxygen desats, and the snoring is happening. So if it gets worse, if the oxygen desats and the snoring are worse when they're on their back, the patient needs to get off their back. It's as simple as that. And you got to keep going, though, because 86 is low. You may want to, if they don't believe you, or they may want to do a little bit more testing, send it back and see if they can stay on their sides. But you'll be able to tell if they go back on their back or not. And this patient probably needs to be, there's some kind of medical issue going on here. And you can tell by the desats. And then if you look at the heart rate here, and usually an adult, and we say usually normal, anywhere from even like 10 years old and up, it's usually between 60 and 100. Now, if we see something below 60, that's usually bradycardia. And if we see it above 100, that's usually tachycardia. That also shows, a medical issue. So the heart rate provides very important information as to the severity of a heart, medical issue. So those two are real important, but you just want to be slow about it and really gentle when you discuss this with a patient, because you are not a physician and you do not need to diagnose anything. However, how great is that as a dentist, we are aware and we can help our patients. And that's what I tell my patients. I just want to do what's best for you. And I'm so glad that you wore the Gym Pro. Do you feel tired a lot? You know, are you sleepy during the day? You know, do you have trouble sleeping? You know, that engages and starts a conversation. And if you see like the heart rate, you know, tachycardia or bradycardia and oxygen desaturations, then this is a good indication that, you know, the patient has moderate or severe disease from a sleep study. You know, you can see it. And if the patient, this is really important, if the patient has severe oxygen desats and a narrow heart rate, say 60 to 80, then this is a sign of a serious medical condition. And, you know, special emphasis should be made to refer this patient to a cardiologist. You know, it's a sign of a serious medical comorbidity. I mean, it is. And so that's important that you can, you know, pick that up and alert the patient without scaring the patient. You know, you just might want to suggest very strongly that they go and seek, you know, a specialist, a cardiologist. Okay, now look at the parafunction. The GymPro, and this is, I think it's only one of the only screening, you know, the monitors out there that does this. And this is why dentists need this, because you can diagnose this. You can show, you know, if a patient, if an insurance company doesn't want to pay for something, you can show that this patient needs it. So it's, you've got evidence, you've got some proof, you've got a backup to help you. But the GymPro measures the nocturnal parafunction on 2 different vectors. So you got to remember this. It's the frequency and the magnitude. So with regards to calculating the magnitude, the GymPro, what it does is it calculates the strength before the test starts, before they even start. It measures the force the patient can generate when asked to bite down hard as they are still awake. So what the patient's going to be asked to do, and you're going to explain this to the patient, they're going to be asked to bite down. You know, the computer is going to pick up and 3 times, and that's going to measure their force while they're awake. And then, you know, the GymPro remembers this force and it compares it to the force generated while the patient's asleep. And you would be amazed. You know, people are amazed because they learn, you know, they clench and grind harder when asleep. And then as the clench went away. I mean, I know that I'm a clencher and I clench so loud and so hard. I mean, not with my clients in now, but before. I mean, you know, people can hear me, you know, like we're in a girls' weekend or something. My girlfriends, you know, they videotape me purring. They think it's funny. Before I had my appliance. Now I don't go anywhere. I even wear my appliance on an airplane because I travel a lot lecturing. And when I go out, I go out. I mean, sometimes I go out so fast that when I wake up, I think we've landed and we haven't even taken off. And so the person sitting beside me, they think I am crazy because I'm like, gosh, we're already here. But I go to sleep so fast usually. And then I clench and purr. But it tells you, and many people, they'll be, you know, when they learn how hard they clench or grind, when they're asleep, then they understand how they fractured a tooth or why they have so much wear on their teeth. And so this is a good thing to explain to the patients. And this is where oral photos come in. This is why it's great to go over this report with the patients. And if you look at it, we calculate the maximum bite force ratio. And if you look, any value greater than 1 means that your patient clenches and grinds, stronger when asleep than awake. So some people clench and grind 3 or 4 times harder when asleep. We also count the frequencies of parafunction as well. The graph on the bottom, the very bottom of the report, is the bite force calibration while awake. So you need to look at that and just see, you know, what's going on so you can explain to the patient. And if you look, you know, many of the boxes are color coded and green means normal. So if you look at the boxes, you look, green's normal for 97, 178, 2.8, and 1.5. Orange and yellow are mild to moderate, and red is severe on the graph. So that's another thing that you need to look at and make sure, you know, you make note of that. Okay, bite registration, airway metrics. This is a good way to help you eliminate the snore, because a lot of patients monitor the appliance by if they stop snoring or not. However, that is not an indicator of whether the appliance is working or not. And you've got to give that expectation to the patient before the appliance goes into their mouth. Establish anterior and protrusive, and establish vertical. Airway metrics. It's a system used to obtain an optimum treatment position for oral appliance therapy. During the optimal initial treatment position, use the snore screener. It will help you. It'll help you with your bite. You will get the best results from using this. And the mandibular reposition key, you'll see it referenced as MRK on the slide. So just keep that in a note. Just keep that, you know, in your notes. The protrusive and vertical positions, and it's designed specifically for dental sleep medicine. It's designed specifically for these oral sleep appliances. And confirm vertical dimension is effective. One appliance is placed. All right. So you've got, you know, just keep up notes with that, and this is what we're going to talk about. Okay, the airway metrics. And it's a system used, you want to get the, optimum treatment position for oral appliance therapy. There's two dimensions, the anterior and posterior, and that's referred to as AP, and then the vertical dimension. Both dimensions contribute to therapeutic benefits for the patient. Sleep apnea appliances offer at least 4 millimeter vertical on the average. So when you use these air metrics, you want to have at least, they'll give you at least 3.5, millimeters, because you have to be opened a little bit, because it's not always about how far the mandible's out. It's not, always about that, because it's not always about, the apnea-hypopnea index either. You got to think about everything kind of goes together. You got to look at the DSATs. You've got to look at the, protrusive. You've got to look at the vertical dimension. And when you look at the vertical dimension, you'll realize that it puts less pressure on the patient's teeth. So there's less risk of movement with the patient. And the, anterior posterior position tends to be more efficient therapeutically, but the patient is introduced to more risk. You're going to have more problems, when you just use that without doing the vertical dimension. You're going to have patients, a lot of tooth movement. You're going to have TMD pain, problems, the patient not being compliant. So the airway metrics establishes the best position with the least risk. And I'll tell you, I've used all kinds of ways to get, the best treatment position, the best position for these patients. And I tell you, when I started using the airway metrics, it's like right on spot every single time. I'm batting 100 usually all the time. And that's why, I'm hoping that I can give you some pointers so that your journey can go smooth without having to go through everything I did to figure out what was the best way to go. So, why do protrusively when you can, and it can be done vertically? So that's what you got to think about. Keep that question in your mind, as well as the 3 questions about medically. Does my patient snore? Do they look like they have, any kind of, medical problem? So those are the things that you need to keep in your mind when you're looking at all of this, and when you're thinking about how you're going to help your patients. Does your patient have hair function? These are important for, for all dentists. If you're doing any kind of restorative work, and the Gym Pro is important for that, for restorative work. It's also important for those of you that are placing night guards without screening your patients. You could be causing an apnea event in your patients with a night guard. And if a patient tells you they wake up and their night guard is on the floor, it probably felt like it was choking them and they took it out. So just keep these in the back of your mind when you're looking at your patients. And you should be screening, the ADA, every dentist should be screening. So if you're not, start the next time you're back in your dental office. Okay, airway metrics, the snore screener. What is the point of the snore screener? It's to establish the most likely mandibular position to eliminate snoring. And so what you're going to do, and what this does is air metrics, it will establish the optimal anterior posterior position and vertical position using a single, remember the MPS key, all right, mandibular positioning simulator. Okay, so remember that and put that on there. And then airway metrics, the snore screener. So without the snore screener in place, you ask your patient to snore and listen very carefully. So you ask your patient to snore, like, did you hear me snore? Like that. And then you start moving it edge to 4 millimeters. And then you ask the patient again to snore. And you got to listen really carefully, because they still could be making some type of noise. And as long as the patient's comfortable, then you want to continue on with the patient. So then you start at natural position, and then you go to 8 millimeters, and you ask the patient again to snore. And you've got to listen really carefully. And it's good maybe to have your assistant in there just so they can make sure they hear and that you're hearing and everything's, everybody's on the same page here. So this is how you start to do this. And then the mandibular position simulator, the MPS, the snore screener established 6 millimeters at the optimal vertical dimension. So snoring at 4 millimeters is what they saw when they put it in. You have the patient, they put their maxillary mandibular teeth in the notch, and you'll see a photo of it in a moment. And they put them in the incisal edges of the mandibular and the maxillary. And then they're snoring at 4 millimeters. So we had to go back to 8, and there was no snoring. So you have to kind of take a little bit, give and take a little bit. So then we did it at 6 millimeters. And so you're using the 8 millimeter MPS key, and you test the 2 to 3 millimeter key, the snore test, and then you test the 4 to 6 snore test, and then you test the 5 to 7 key for the snore test, because you're going to get both the vertical dimension, and then you're going to get the protrusive as well. So what we did is we did the 6 millimeter, and if you look at the vertical, and then the protrusive was between the 2 to 3 millimeter key, if you see that right there. And so that's how you determine the vertical and the protrusive. And I'm telling you right here, if you use this system, you will have no problems. The patient will be more compliant. It'll be easier for the patient to adjust to the appliance. The patient's not going to have to keep coming back for adjustments, and the patient's ready to go. I mean, I see my patients now, and I've changed it all since I've been using this. I see my patients when I deliver it. I see them in a month, unless they have any problems before, and I rarely ever see them until a month. And then I see them between 4 and 6 months to retest again, because I have a baseline, and then I go back and see how efficient this appliance is doing. And that's why I like the Gym Pro as well, because I do it with the Gym Pro. I get a baseline, and then I do it again with the appliance. And this is what I show physicians, to show them how wonderful these sleep appliances are, and that why they should refer their patients to me, because I will take very good care of them, and I will keep up with them, and I will follow up with the patients. And that's what they want. Okay, so the bite registration. The snore screener established, remember, 6 millimeters at the optimal vertical dimension. And then the MPS key established the protrusive to be 3 millimeters. And remember that we did this by putting this in the patient's mouth and having them snore. It's very, very simple. It's so easy to do. The Gym Pro is easy. This is easy. Sleep is easy. It's not hard. Everybody should be doing this. And if you're not, send them to me, okay? So 6 millimeters for the MPS key, and it's pointing to where that's located. So look at the slide, because then when we do the bite, and then the 3 millimeter notch, the patient could not snore in this position. So this is a great place to start for this patient. Okay, and we're going to discuss the material that you would use in the anterior area. And it's Futar D and Futar D Fast. And Futar D is a syringeable elastomeric silicone for bite registrations, and it has an extra high final hardness. So this is what you're looking at, and this is what you're going to use for the anterior material of the bite registration. And for the posterior material, we're going to use the Panasil Putty Soft. And this is, you take a scoop of each out of the putty. They're different colors, so you're going to take a scoop of each of them, and it's really, you just knead it together. It's a classic kneadable precision impression material, and it's available in tubs. So it's very easy to use, and it works great. And, they keep refining it over and over. They have, been in, business for 35 years. They have experience. So this is a great material to use. And I don't get anything out of, all this stuff I'm telling you. It's just what I do in my practice and what works. And why try to reinvent the wheel when I wish someone would have given me, all this, knowledge and experience, because that's what it's from. I was, whether you're starting new or whether you've been in it or whether you just want a refresher course, but I've had to go step by step, and I've backed up 100 times to get it right. So this is what the completed registration looks like. It measured both, the anterior and posterior position, and it did the vertical dimension. And look how nice it is. And then when you send this in, and remember, anything you send to a lab, whether it's a bite, whether it's an impression, you want it to, be sent as nice as possible, because that's what you're going to get back. What you send is what you're going to get back in return. So remember that. And so now we're going to take an impression, and we're using the Panasil, the normal pack, and then we're using the putty again. It's so easy to work with, and my team, they love to work with. It's not messy, and it's easy to work with. So, and this is how you take an impression. These are what impressions should look like. There should be no bubbles, no voids. You should see the occlusions should be very detailed. It gives you the best appliance. You want it to fit right, because when the appliance comes back, if it's too tight, it's not going to work. If it's too loose, it's not going to work, because you don't want to have to go in there and adjust it. So the more that the lab can get from you, detailed occlusion, you want to capture the distal surfaces. You want to make sure that appliance is going to go over that and capture what they need. They don't want to guess at it, because it's not going to be comfortable to the patient. It's not going to work. You want to make sure that the impression material is intact. You don't want loose ends or, pulling from the tray. You want to make sure that you get the best. You might want to use a tray that's, one size larger. If you need to extend the tray, just like we did with dentures, you can use rope wax. It's just great to have a tray that fits, because you're going to get a good fit. And make sure that all the gingival margins are clear as well. Hey, Jeff.
Yeah.
You want to come in?
Yeah.
On the Burbank?
Pass the football over to me, and I'll take it from here.
I'll send it up to you. Let me make sure I can get my hold tight. Got it?
Got it. Thank you. All right. So I'm going to take over here, guys. So first of all, before I get too far into this, the folks at Kettenbach. So Dr. Mericle talked about materials, and that almost seems like it's an important aspect of this, and I'll tell you why materials make a difference. And I'm probably preaching to the choir, but the appliance you get back can't be better than the impression you sent. Okay, so it's really important. You guys know this. I probably don't need to say this, but it's a really good proven material, and I'm a big fan of the product, and it's a great company. They have a great culture there, and for myself, I like to do business with other companies that have a similar culture that I have. And Kettenbach's just a company that I appreciate, and so that's why that's why Kettenbach was the first company I reached out for when I started this. The second company that I reached out to was Burbank Dental. Now, Burbank Dental and DDME goes back from our very beginning. In fact, I was working with Burbank Dental before I even started DDME 10 years ago. Labs, not all labs are the same type of lab. There's the mom and pop lab, there's the Glidewell, and then there's the Lexir cluster of labs, and then there's the large individually owned lab. And Burbank falls into that corner, that category. It's for they're owned by a family, and they've been run by the same family for many, many years, and it's a great group. So what Burbank Dental distinguishes themselves is they're entrepreneurs as well, just like everyone on this call is, including Shannon, myself, Dr. Mericle, and every one of you on this call. We're all entrepreneurs, and Burbank Dental is the same way. And so they appreciate that, and they take particular care of their customers. So let me talk about them for a little bit. One, they've been around forever. They have a lot of experience. They have the latest equipment. They're in a very cool area, and they have a great training facility. The ATC, Advanced Training Center, I believe was what they call it. It's right in the heart of Burbank. So if you ever want to go to a cool seminar, it's in Burbank, and it's right in the middle of, you probably see a bunch of famous people. It really is in the middle of that. And it's a top of the line training facility. They got this operatory set up, and they got cameras, and it holds about 45, 50 people. So it's a good training facility. With regards to the sleep appliances, they offer two, one of them being EMA. The EMA is a good, efficient appliance. I think it's cost effective. The lab fees range wildly now. There's the $90 fee up to the $600 or $700 lab fee. This is on the bottom part of the scale. So if economics are a factor, and obviously that is, especially now, it's a very popular, proven way to manage the airway. And it's now, I will tell you, based on collecting data with the Gym Pro, you'll know if you got a clincher and a grinder, and you'll know that if it's going on currently or not. Because sometimes wear, if you just look at wear, it's historical damage, and maybe they're not clenching and grinding anymore, or maybe it's current, maybe they are in clenching and grinding. So if they are, maybe you don't want to get an EMA. Maybe you want to get the other appliance that's available at Burbank, which is the TAP 3, the Thornton appliance. And that's a really sturdy appliance. It's got an interior hinge. So if it's very popular, way to go. And I think that if you're going to get into sleep, the EMA and the TAP are the two kind of go-to appliances for a lot of dentists. So I did want to mention that.
Do you mind if I say something?
Oh yeah, go ahead, please.
Can you hear me?
Yes.
Go back to the TAP and the EMA. Yeah, the EMA and the TAP, those are my two favorite appliances. I use the EMA so much, and I even use the EMA now that, when you use the Gym Pro, you'll be able to understand how this works. With the EMA, sometimes you'll have a patient, and Jeff, you can go back, respond back to me on this, because the EMA is for, obstructive sleep apnea, mild and moderate, and it can be for severe if the patient cannot tolerate the CPAP. However, the EMA, I use that a lot when a patient shows that they're bruxing and clenching, not to a high extent, but then they also have a little bit of desaturation, but it's not going to be diagnosed as apnea. And that way, and I use this a lot instead of just using a night guard on patients. I wear this appliance, and it's one of my favorite. And I use this so much in my practice. And then for the TAP, not only is the TAP a great appliance, and I wear that also. I have a ton of them. Some I keep in my suitcase, some I wear, I take on the plane. I told you, I take in the office because I take a nap every day. So I have them everywhere. The TAP also, if you look in the back, it just has the hinge in the front, and it's easy for a patient, especially the older patients that you have, to get the key in there and just turn it. And if you look in the back area, it moves so the condyles have a little bit of freedom. So patients with TMD, TMJ issues, this works really well for these patients. And this is an appliance that is Medicare approved as well. So if you're a DME provider, this is a great thing to do. Okay, thank you, Jeff.
Yeah, sure. I appreciate that, because, and that just to remind everybody, I am not a dentist. So I think one of the deficits that I have is that I don't, these key essential things that you learn about treating when you don't practice dental sleep medicine, that's great info. So here, I just wanted to take a moment to talk about the vertical dimension. Part of the Airway Metrics toolkit, you do get a vertical titration keys. And here's why I'm a big fan of this. And there's, the literature is mixed on this. I know that soft tissue is a tricky thing. It's a fickle friend, and it's very difficult to predict reliably what soft tissue is going to do in any given scenario. And so, for example, you might do, positional therapy might work on one patient and not another, and it's very difficult to predict. So why even risk considering the vertical dimension as opposed to just using the protrusive or the horizontal dimension when you're titrating? And the reason is AP, when you go more and more protrusive, you're just putting more pressure on the joint. To get the soft tissue out of the way, if that's what you have to do, then that's what you have to do. And there's, I'm not negating that, obviously. But if you happen to have a patient that can respond to vertical as opposed to tugging more on the mandible, then that vertical puts less stress on the joint. Okay. Now, so that's the good news. If you can get somebody that, if you get 6 or 8, no, maybe not 8, but 6 to 8 millimeters vertical, you might get them off their back. You might not have to put much pressure on, by pulling out their mandible. Some patients will respond that way and some won't. Okay. So I'm a big fan. My motto's always been measure and know. Okay. So when you get your appliance, when you're delivering your appliance, if it's the type of appliance that you can adjust the vertical dimension on, I'm a big fan of checking, because the less torque you put on the mandible and the masseter muscles in the joint, the less risk of side effects that you have. Okay, so I always say, why do protrusive if you can do it vertical? Okay, but what's the risk of vertical? There's really no risk other than it doesn't work for a lot of people. It works for some number of people, and in the literature, essentially what happens is when you kind of open up the jaw in certain scenarios, you're actually pushing the soft tissue back into the airway. And that is the case for a lot of patients, not every patient. It just depends on that soft tissue configuration and the geometry of the airway. So the best way to manage that is to use a vertical key. And if you can open up the airway by splitting the protrusive and vertical and get a perfect airway that way, as opposed to just going protrusive, I'm a big fan of that. Okay, so I did want to mention that. And I'm wrapping up here, and there's a couple things that I wanted to do. I know we're at the hour mark, but there's one thing that I wanted to do. I wanted to poll the group, and there's a lot that's happening to us all as far as COVID-19, opening your practice, new infection control practices, and so I want to ask you a couple of questions and kind of get a sense I'm going to ask you questions about some of the products and things we've talked about, and then some of the impacts that COVID-19 has had on your practice. So I'm going to do a poll real quick. So I'm going to ask you guys a series of questions. And if you could just, for those of you still kind of watching, the first question I'm going to ask you is, are you screening patients and do you use the device? And it's a simple kind of yes or no question. And if you're not using a device and just using a questionnaire, then the answer is no. If you have like an oximeter or a Gym Pro or something else that you use, then just answer the question there. And I appreciate you guys answering. I see that you're answering. I got 4 or 5 questions here, so I'm going to move along pretty quickly on this. So it looks like on that one, 43% have something, and about 50 something don't. Okay, so that's an interesting outcome. All right, so that's good. So I'm going to ask another question here. Okay, so a George gauge. Those of you doing sleep, are you guys using a George gauge, or have you used one? And I'm just curious. The George gauge and the Airway Metrics, they're kind of competing products, and I was just curious. It looks like there's a pretty even split on this one. So I appreciate that. That's great that you guys are participating, because right now it's 50-50 on the George gauge. So that's an interesting outcome. Okay, so I'm going to ask another question here. The next question is digital impressions. Okay, so there is a paradigm shift on digital impressions. So some number of you are currently doing digital impressions, and if you're doing them, even if you're doing it infrequently, but you're scanning, but you're not doing it on every single patient, that's a yes. If you're not scanning at all, then that's a no. So I'm just trying to get a sense of how this quote unquote paradigm shift is playing out, as far as what you guys are doing today. So that's good, interesting. So 71% are not scanning. So that's interesting. That's really interesting information. I appreciate that, guys. Thanks. All right. Okay, this is not a pet peeve, but this is a pet project that I have. And I have to explain what remote patient monitoring is. So as I'm polling this, I'm going to explain to you the question. When a patient's on CPAP, the CPAP device automatically measures how the patient's doing and whether or not they're using the CPAP, and creates a report and sends it to the DME provider who gave the patient their CPAP unit. So that provider has an idea of exactly when their patient's using it and how effective the device is. In dentistry, we have a way of doing remote patient monitoring in a similar fashion, okay? Now with dentists, Typically what happens if you're treating a patient with sleep apnea, you'll send the patient home with an oximeter, let's say, and you might get a night or two snapshot, maybe even a 3-night snapshot. What's different about the CPAP unit is the CPAP unit collects the data every single night. And so at the end of the month, that DME guy knows, okay, this patient used it for 4 days out of the month, so we got a problem. Or the patient's, happy and they're using it every night. And in dentistry, we don't have a tool, but we do have one now. So I'm curious to know if you guys would be interested in learning about this dental tool that a patient can wear it every single night, get you a report every night, and on that report, it will have their oximetry and a sleep histogram they wear a ring. So that's what I'm talking about. Okay, so I'm going to close that one. Thank you. I know that one kind of took a while. Okay, so this one's kind of comes on the topic of current events. Okay, so this is a COVID-19. So here's something that I'm going to be launching next week. And what I'm going to be launching next week is the ability for a dentist to be able to test their patient for COVID-19 antibodies. Okay, so I've been testing this myself. I've ordered the kit. There's a web portal, and it's a blood test. It's not the swabs. It's not some of these kind of fly-by-night testing. It's a very credible, university-based, highly accredited lab that processes the data. It's a little bit expensive, but it's a very good way to determine, one, if your staff has been exposed to COVID-19, then you'll know their level of antibodies, which is great information. And for you, and imagine being able to tell your patients, hey, I've tested everybody in the office, and we know that everyone's either been exposed and immune, or we're not letting people who haven't been exposed or contagious into the lab. I mean, you would know that because you've been able to test it. And moreover, imagine people coming to your office to find out if they've been exposed. Okay, so the reason I like that idea is the challenges that we all face in dentistry right now is getting the confidence of our patients. Okay, our patients have been hammered for 2 and 3 months, just like you've been hammered. And for them to come back to a dentist, there's going to be some amount of resistance there. And I believe that resistance can be met if you could tell your patients, listen, come on in, let's get you tested. Let's see where your antibodies are. It's as simple as a glucose test. It's that simple. Okay, so that's that one. Thank you, guys. There are some people that 11% said no on that. So that's interesting. Okay, so that's basically what I wanted to do with the poll, and I have the results of that. And I appreciate you guys participating in that. It helps us get feedback as to what types of things you're interested in and what you would like to do. And at this point, here's what we're going to do. We're going to open this up. So I invite you to go to your questions, your little questions tab, and start asking questions. And Shannon is going to kind of review those. So there's still, 60 people on the call. So I really can't. Personally, I'd like to just open up the mic. But I think that it's just not a good idea because of the number of people, which is a beautiful problem to have, and I'm grateful for that. So if you have a question, please go to your question or chat box and type in your question, and let's see if we can't get your questions answered. While you guys are doing that, I will tell you a couple things. One is your CE certificate will be emailed to you. We have to confirm that you attended and were online for the duration, which is, we get a report on these webinars. And then we'll email you the certificate. Now it's going to take us a few days because in that email, I'm going to send you a recording of our webinar. Okay. So that's going to take a day or two to get that done. And then also confirm that everybody was online. And then our friends at Burbank Dental are going to be the ones that are issuing the CE credit for you guys. So know that that's going to be a few days. If you don't hear from us, and at the most a week. You see my email address there. You see my cell phone number there. I invite you to contact me, whatever way is easiest. You can send me a text, call me, send me an email, say, hey, where's my CE credit, Jeff? Or I have a question, or whatever the case might be. So, and the reason I'm kind of looking back, I have like a test unit here, and it's the screen. This is a kind of an attendee screen. The screen that I have, because I'm a moderator, is completely different. So that's why I'm kind of looking back at that. In fact, I think at this point, I'm going to just go ahead and turn my camera off.
Okay.
All right. So
I'll just stay here.
let's see. It looks like Glenn. Glenn, you're raising your hand. Oh, there we go. Oh, okay. So I see. Aaron. Yes, Aaron made a comment that when we were setting it up, we were kind of broadcasting. And I did notice when Aaron made that comment that you can start a meeting without broadcasting. So, Aaron, future webinars, if you're still here, we got that. John, it's good to see you. Dr. Buzzard, thank you for that comment. Let's see, Larry, Dr. Haynes is up. Do you take anterior and posterior aspects of the impression at the same time? Yes, but also no. Okay, so when you capture using the gauge and you put the key in the gauge and then you kind of lay a bead of registration material, at that point, yes. So you've selected a key that's, let's say on the snore key, you learn that they can't snore at 6 millimeters. So then you use the 6 millimeter AP key, anterior protrusive, and you learn that it takes 3 millimeters to get the patient not to be able to snore. So then you put that key, the 6 millimeter vertical and the 3 millimeter AP, and you insert that into the bite registration, and then yes, you do. During the impression, obviously that's a different question altogether. So hopefully, Dr. Haynes, I hope that answers your question. Dr. Buzzer, Debbie, you're asking, are you launching COVID-19 test? It is a finger stick. Cost right now is a single test is about $165 to you. I will have to get back to you as to if it's covered by insurance. Here's what I know. It does not require a physician prescription. It is the blood test. So you order for the $165, you get a kit mailed to you. You log onto a portal, and on that portal, if you're the distributor of the kit, then you would get the kit and give it to your patient. You can order 6 kits at a time and get a nice discount. And then you could, in that case, you would kind of market yourself as a test center. And I really like this idea because, this is going to sound corny. All right, I'm going to confess, this is going to sound corny, but we need a lot of testing. And, dentists spend more time with their patients and are more invested in their well-being than, say, other healthcare providers, to be, diplomatic. And this is really, really important, and it doesn't require a prescription. And so for $170 to you, and you take a pinprick, you put 4 drops into a receptacle, and you close it up and you ship it away, and 2 days later, you get an email saying your patient's level of antibodies. I'm not going to get into the detail, but I am going to be doing another webinar on it. That's how it works. And this is going to be really important to your health. And I think it's also going to help you get patients back into your office. Randa, let's see what you're saying. Please send me information about the COVID. Okay, will do. Kenneth says hello. Say hello. Let's see. Great smile. I think you were maybe talking about Shannon. Tia said, Dr. Mericle, thank you. She appreciates that. Dr. Daza, great to see you. When would you go directly to a sleep test versus a GemPro? Oh, that's a great question. And so the question, so here's my answer to that. The GemPro is a dental screener, and a sleep screener or a medical screener does one thing. It's used to diagnose obstructive sleep apnea. And if the only thing you care about is the patient has obstructive sleep apnea and they're built like me and they're tired and they have every symptom, then send off for the sleep study. If, however, you want to know if the patient snores or if they have nocturnal parafunction versus daytime parafunction, or maybe it's not as clear as it would be in my case that they have sleep apnea, that's when you would do a GymPro study. Okay, and the GymPro study also kind of penetrates the patient's reluctance to cross that bridge. So one of the bridges, that's the bridge that I'm talking about, is, hey doc, I'm here for you to clean my teeth. What are you talking about? Snoring and sleep apnea. I don't. And then you can say, listen, you know what? I got a dental screener. Let's send it home to you. I don't charge anything, and let's see what's going on. Okay, you can get to the yes there. If you go straight to let's order a home sleep study, sometimes you'll meet with some resistance. So that's my answer. That's a great question, by the way. Thank you. That's a really good question. Okay, do you put both silicone and the polyether on the tray at the same time? Larry, I am not the person to answer that question. I will, I don't know if Dr. Miracle's still on, but I will get back to you on that. Okay. Where can one buy the Gym Pro and how much? Okay, that's my favorite question on the whole planet. Okay. So the Gym Pro is just give me a call or send me an email. The retail price is $1,957. And one thing I will say is on the question, well, okay, I'll just be straight with you. Not that I'm not straight, but just for coming to the webinar, we're going to take $100 off. So it's $1,800 plus shipping. I think shipping's like 57. So it's $1,857. Okay, and we'll ship it to you. And that includes everything you need to do 50 studies. 50. That includes the training, the report interpretation. We'll teach you how to interpret those reports, and you have access to Shannon and myself, and then there's other services that Shannon will talk about. You know, when she's getting you up to speed with the Gym Pro, and I will tell you, people are very happy with our service, and we have an optional service that extends past the period of time that we're getting you up to speed, and almost everybody signs up for it, but it's optional, totally optional. I encourage you to do it. I think once you see the level of service, you'll have no problem making that decision. So, okay, thank you. That's Car. Thank you for that question, and please contact me. Okay, Kevin Lynn. How accurate is the antibody? Oh, awesome question. Okay, here. Let me actually show you guys something real quick. So here's my little antibody. So those of you that are still on here, my second slide, there's your answer right there. 90%. Okay, so that you say, oh, sure. Because, like the test, this is better than the test that the President of the United States is doing, okay? He's doing the swab test, all right? This is a blood test. It's much more accurate. It's very reliable, but it's more expensive and it's a little bit slower. This takes a couple of days for you to get the results. But we test two antibodies, the IgM and the IgG. And the IgM means that you are exposed and your body is in the process of responding to the virus. That means you're probably contagious and you've been exposed and you have it. If you test positive for IgG, that means you've gone through the process, you have that antibody in your body, and you have some amount of resistance and you're not contagious anymore. Okay? And that is 90% sensitivity and specificity. Okay? And that's assuming we have a good sample. Okay? With a good sample, it's very, very accurate. The process is called ELISA. That's a blood processing or blood methodology. And the lab we used is CLIA, which is like it's a third-party organization that labs pay money to certify that they are at a certain level of operation. So the lab that we use, it's in Missouri. So the kits are made in the U.S. and the test is performed in the U.S. and in Missouri, so it's right in the middle of the country. So great question. So all right, so that is that one. Using the next webinar, yeah, sure. We'll first of all, that question is, I take that as a compliment, and we will do that. I appreciate that you asked that question, and yeah, we can show you. There's a video that I just saw today on it, but it was too late to add it. So I will add the video of both the bite registration and the impression as a video. So yes, we will do that. Great questions, guys. Appreciate it. Can you have false positives from people who have been vaccinated with flu shot? No. So here's something that's tricky. The SARS-CoV-2 is it's different from other virus strains, okay? And that's a good thing based for the question that you asked, but it's a bad thing because we're completely unprepared for this particular strain. This is why it's such a problem. So because it's such a problem, it's a different enough strain that it's very easy to distinguish between the antibodies that are being produced by the body as a result of being exposed to SARS-CoV-2, as opposed to say MARS or one of the other strains that people have been exposed to. So yeah, that's a really good question. And unfortunately, because it is unique, and another kind of negative aspect of this is that the COVID-19 or strain mutates a lot. So what we don't know is, let's say in the fall, we have another strain that's slightly different. The COVID-19 strain mutates a little bit over the summer. How different is that strain going to be to the strain that's impacted us right now, or the one next year? Okay. And as with any vaccine, which we hope we get sooner rather than later, at best vaccines last a year. So, now we're looking at, a vaccine that will, if it behaves in a similar fashion to other vaccines, then this vaccine will last a year and the next year. But again, the sinister nature of this particular virus is that it does seem to have proclivity for mutating frequently. So that's a kind of a negative thing. So anyway, okay. All right, so that's it for the questions. And I think if you guys have any other questions, I'm going to go back to putting up my phone number and my email address. So it should be on the screen there. I invite you to contact me at any time if on anything, any topic that we talk to, or you just want to call and say, whatever. I do like meeting people, and I'd love to hear from you. So without any other questions, we're going to go ahead and end this. And I appreciate you all coming, especially, there's still 54 people here, so that's.
And I also wanted to say happy birthday, Dr. Mericle. I hope you have a wonderful birthday this evening and today and the rest of the month.
Thank you very much.
Yeah.
Okay, guys. Any other questions or comments before we end the session? Okay, with that.